Hello, kumusta ang lahat? And ang pag-uusapan natin ngayon ay tungkol sa ethical principles and counseling practice. At the end of the discussion, students will learn first to understand the ethical principles and issues that you are bound to face at some point in your counseling practice. And the second one, make affirmations that help you become an ethical counselor. So there are 5 common ethical dilemmas in practice. Yung una or the first one is ethical decision making. Pangalawa is yung informed consent. Pangatlo is confidentiality. Yung pang-apat is ethical aspects of evidence-based practices. And the last one is multiple role relationships. So let us first define what is ethics. When we say ethics, it is the suggested standards of conduct based on a set of professional values on moral decision-making regarding professional behavior. So una, let's first discuss yung nandun sa ating subtopic, which is ethical decision-making. So knowing and following your profession's code of ethic is part of being an ethical practitioner. If you are an ethical practitioner, you can probably be a very effective one. So there are steps in making ethical decisions. Yung una or the first one is you have to identify the problem or dilemma. Aalamin muna natin kung ano ba yung problema o yung dilemma. Paano ba natin ma-identify yung problem or yung dilemma? First, you have to gather information that will shed light on the nature of the problem. This will help you decide whether the problem is mainly ethical, legal, professional, clinical, or moral. The second one is identify the potential issues. You have to evaluate the rights, responsibilities, and welfare of all those who are involved in the situations. And for the third one, look at the relevant ethics codes for general guidance on the matter. You have to consider whether your own values and ethics are consistent with or in conflict with the relevant guidelines. And for the fourth one, consider the applicable laws and regulations and determine how they may have a bearing on an ethical dilemma. And for the fifth one, seek consultation from more than source to obtain various perspectives on the dilemma and document in the client's record what suggestions you receive from these consultations. And for the sixth one, brainstorm various possible courses of action. Continue discussing options with other professionals. Include the client in this process of considering options for action. Again, document the nature of this discussion with your client. And for the seventh one, or 7 steps, yung ikapito, enumerate the consequences of various decisions and reflect on the implications of each course of action for your client. Decide on what appears to be the best possible course of action. Once the course of action has been implemented, follow up to evaluate the outcomes and to determine whether further action is necessary. You have to document the reasons for the actions you took as well as your evaluation measures. Remember, laging tatandaan, in seeking consultation, it is generally possible to protect the identity of your client and still get useful input that is critical to making sound ethical decisions. So meron tayong tinatawag yung confidentiality dapat nandun lagi. Because ethics codes do not make decisions for you. It is a good practice to demonstrate a willingness to explore various aspects of a problem, raise questions, discuss ethical concerns with others, and continually clarify our values and examine your motivations. To the degree that is possible, include the client in all phases of the ethical decision-making process. So dapat alam ng client natin yung proseso sa decision making. It is essential to document how you included the client as well as the steps you took to ensure the ethical practice. The second one is the right of informed consent. When we say informed consent, it involves the right of the clients to be informed about their therapy and to make autonomous decisions pertaining to it. So dapat alam ng client natin kung ano ba yung mga gagamitin natin sa kanilang therapy or paano ba natin sila ika-counsel, ano ba yung process natin. It's their right to know. Some aspects of the informed consent processing include, so ito yung mga kasama dun sa informed consent. The first one is general goals of counseling. So, dapat alam ni client kung ano ba yung goals dito sa pagka-counsel natin sa kanila. The responsibilities of the counselor toward the client. Yung responsible natin bilang counselor sa ating kliyente. The responsibilities of clients. Dapat alam din nila yung kanilang responsibilities. Limitations of and exceptions to confidentiality. Dapat alam nila yung mga limitasyon and exemption to confidentiality. Legal and ethical parameters that could define the relationships. The qualifications and background of the practitioner. Dapat alam nila yung qualifications natin and yung background natin. The fees involved, the service the client can expect, the approximate length of the therapeutic process. So, dapat alam nila kung hanggang kailan lang. For example, 2 to 3 months lang yung counseling, 4 to 5 months, depende. Dapat aware si client. Further areas may include the benefits of counseling, the risks involved, and the possibility that the client's case will be discussed with the therapist's colleagues or supervisors. This process of educating the client begins with the initial counseling session and continues for the duration of counseling. So always remember, informed consent in counseling can be provided in written form. So pwede kayo may papipirmahan. Orally, pwede nyo sabihin, or some combination of both. Or some combination or both. Pwedeng written, pwedeng oral, or pwedeng combination. If done orally, therapists must make an entry in the client's clinical record documenting the nature and extent of informed consent. It is good idea to have basic information about the therapy process in writing, as well as to discuss with the clients topics that will enable them to get the maximum benefit from their counseling experience. So written information protects both clients and therapists and enables clients to think about the information and bring up questions at the following sessions. So pupunta na tayo sa dimensions of confidentiality. So when we say confidentiality, it is an ethical concept. The legal duty of the therapist not to disclose information about a client. So meron naman tayong tinatawag na privileged communication. When we say privileged communication, it is a legal concept that generally bars the disclosure of confidential communications in a legal proceeding. So confidentiality is central to developing a trusting and productive client-therapist relationship. So kailangan pag nagka-counsel tayo, meron tayong tinatawag na confidentiality. Counselors have an ethical and legal responsibility to discuss the nature and purpose of confidentiality with their clients early in the counseling process. Clients have a right to know that their therapist may be discussing certain details of the relationship with a supervisor or a colleague. In determining when to bridge confidentiality, therapists must consider the requirements of the law, the institution in which they work, and the clientele they serve. So here are some other circumstances in which information must be legally reported by counselors. So when the therapist believes a client under the age of 16 is the victim of incest, rape, child abuse, or some other crime. For the second one, when the therapist determines that the client needs hospitalization. When information is made an issue in a court action. When the clients request that their records be released to them or to a third party. So ito yung mga circumstances na kailangan nating legally i-report. Pwede, ano po. In general, the counselor's primarily obligation is to protect client disclosures as a vital part of the therapeutic relationship. Informing clients about the limits of confidentiality does not necessarily inhibit successful counseling. So we will come now to the fourth topic, which is ethical aspects of evidence-based practice. So mental health practitioners are faced with the task of choosing the best interventions with a particular client. For many practitioners, this choice is based on their theoretical orientation. In recent years, however, a shift has occurred toward promoting the use of specific interventions for specific problems or diagnoses based on empirically supported treatments. Mental health practitioners are faced with it. Naulit natin. So the trend towards specific, empirically supported treatment is referred to as an evidence-based practice or yung tinatawag nating EBP. The integration of the best available research with clinical expertise and the context of patient characteristics, culture, and preferences. So the central aim of evidence-based practice, yung tinatawag nating EBP, is to require psychotherapists to base their practice on techniques that have empirical evidence to support their efficacy. So the fifth one is managing multiple relationships and counseling practice. Meron tayong tinatawag na dual or multiple relationships, either sexual or non-sexual, occur when counselors assume two or more roles simultaneously or sequentially within a client. So ano ba yung tinatawag nating multiple relationships? Yun yung kunwari kaibigan mo si client, tapos kliyente mo pa siya. So nagkakaroon na ng conflict or meron na kayong dual or multiple relationship. The term dual relationships and multiple relationships are used interchangeably in various professional codes of ethics. And the CIA uses the term non-professional relationships. So there are ways of minimizing risk. So una, set healthy boundaries early in the therapeutic relationship. Informed consent is essential from the beginning and throughout the therapy process. Involve clients in ongoing discussions and in the decision-making process and document your discussions. Discuss with your clients and what you expect of them and what they expect from you. Consult with fellow professionals as a way to maintain objectivity and identify unanticipated difficulties. Realize that you don't need to make a decisions alone. So when multiple relationships are potentially problematic or when the risk for harm is high, it is always wise to work under supervision. Document the nature of the supervision and any actions you take in your records. Self-monitoring is critical throughout the process. So you have to ask yourself whose needs are being met and examine your motivations for considering becoming involved in a dual or multiple relationship. So now we will come to becoming an ethical counselor. Becoming an ethical practitioner is not a final destination, but a journey that will continue throughout your career. So this is the references. It's The Theory and Practice of Counseling and Psychotherapy by Gerald Curry.